Welcome to the Sweet Life Coaching Podcast, connecting real people with expert advice to achieve a healthier lifestyle and live a more fulfilling and abundant life. Here is your host, Coach Tavia.
Well, hello, everybody, and welcome back to the Sweet Life Coaching Podcast. Again, your host, Coach Tavia here. And I have a very special guest with me. You guys know this. I always have special guests, but this is an extraordinarily extra special guest for me today that I'm so happy and so pleased that I can share with you. We talked about May being Lyme Awareness Month, and this month in particular, I told you I was going to bring you some special guests on. Well, I am super excited to bring in today Dr. Christopher Wakely. Hello, Dr. Wakely.
Hi.
Dr. Wakely is not only my doctor, you guys, that I met 5 years ago when I was going through the Lyme process, but he's many other people's doctor as well. And Dr. Wakely is amazing from so many special reasons, many reasons. I just can't even get into those, but just a little background information. So he is a naturopathic doctor over in Linwood, Washington, and he graduated from Bastyr University in Seattle. And he works with a lot of complex patients, if you will, and patients all over the United States come to visit him. He's very, very well known to treat mainly chronic illness, but other things as well. He uses this tools and techniques that you may not have heard of. And that's why I'll just say he's so special. You're so special. So anyways, without further ado, we're going to jump in today. We're going to talk about Lyme disease because that's what the month is about, is Lyme disease awareness. And we're going to get some answers to the questions that you may have if you may possibly think you have Lyme, or you have someone that loved one, or you're struggling with Lyme. These may be some great answers to some questions that you have out there. So, Dr. Wakely, we're going to dive right in. First of all, again, thank you for being here. Appreciate it.
Yeah, I'm delighted.
And so, Dr. Wakely, we're just going to dive right in again. And what kind of patients are you seeing right now? What is your scope of practice? What are the patients that are coming to you?
Well, first, let me say thanks for having me on. I think this is going to be a good time, and what a great month to do it. So
Yeah,
the patients that I typically see they're like mystery illness patients.
Right.
They've typically seen between 11 and 15 physicians before they get to me. And they've tried a whole bunch of different treatments, medications, and usually they've either failed or they've got like they get a little bit better.
Right.
Patients have typically been worked up for all of the kind of conventional diseases, and the doctors have kind of thrown their hands up. So the thing that separates my practice is that when a patient sits down in front of me, I'm looking at them through a lens of environmental toxicity.
Right.
So in addition to looking at regular things like blood work and other diagnostic tests, we're looking at heavy metal toxicity and chronic latent viral infections and parasitic infections, and obviously Lyme disease and co-infections, mold toxicity, chemical sensitivity. And usually the patients that come to me have one or more of these. And so those are the kind of patients I see. And then in terms of, you asked about scope of practice. So I'm a naturopathic physician in Washington State, which means I'm a fully licensed physician. I can order labs. I can prescribe medications. There's only a couple medications I can't prescribe, and those are scheduled medications like pain drugs. And, we try and get people off that stuff, not put them on it.
Right. We don't need more of that.
Yeah, we don't. Those are Band-Aids.
Right. Exactly. Okay. So great. So yeah, you see a lot of the chronic illness people. The people that come to you are the ones that are like, I don't know what the heck's wrong with me. I've seen 10 different doctors and no one's given me answers. And I'm just playing like we like to call, you always say whack-a-mole. I love that. Mm-hmm. Where you're like hitting the thing. You're like, one thing goes away and then another thing comes up. Right. So Yeah. Okay. Gotcha. So what are some of the signs and symptoms that you typically see in patients that start with you? You did mention a few of them, but what are the atypical?
Yeah. I mean, so it really can run the gamut. So, brain fog, fatigue, weight issues, whether it's weight gain or weight loss, weakness. I talked to a 14-year-old girl yesterday. She has to go up the stairs one at a time.
Wow. So sad.
And, that's significant weakness, right? Gut stuff. So constipation, diarrhea.
Yeah.
I mean, if your gut's not working, you're not able to get toxins out. They're staying in you and recirculating in your bloodstream. I see a lot of neurological issues. So problems with vision, floaters, weird blurriness, flashes in the eye. Air hunger is a big one. Like people feel like I just can't get a deep breath. Tremors, insomnia. If your sleep is off, that's a big deal.
Oh yeah.
And we can talk about that later if you want, but also, a lot of joint pain.
Yeah.
Pain in general, right? Whether it's muscle pain or joint pain. And then like anxiety, depression, blood sugar issues. The list goes on, but I'd say that's if anybody has, a few of those or, one or more of those, and it seems like it's not getting any better, I would really encourage your listeners to reach out to somebody who's trained in looking at environmental toxicity.
Right. Absolutely. Now you'd mentioned something about a 14-year-old girl. Are you seeing young cases, young kids sicker and sicker? Is this something that's, that you're seeing in your office?
Yeah, that's a really good question. So the first thing I got to do is I've got to kind of balance that out because my practice is different, right? I don't do general family practice where I'm just having people kind of show up off the street. People are finding us because they're really ill. But I would say in my sphere, yes, I see a lot of teenagers. I see a lot of young patients who, parents tell me, they were fine until, they were 9 years old. And then they started having this one little thing and we didn't think it was a big deal. And then, it blew up into this bigger thing, like this kid that I was just talking to last week who now can barely walk.
Jeez. Why? Do you have any guesses why this is happening? I mean, we're going down a rabbit hole right now, but I'm just kind of picking your brain here.
Yeah. No, I do. And I mean, obviously this is all just my opinion.
Yep.
I don't have any data to support this. I'm sure I could find some, but I do. I think, okay. So just cut me off, Tavia, because sometimes I get on a roll with my tangents here.
Roll with it. Go.
So, in the past 60 to 70 years, our environment has gotten dramatically more toxic. Okay. And that's not a controversial statement. That's just the facts, right?
Correct.
And when you look at the way that food is manufactured, when you look at the stuff that they're spraying in the air to control for pests, and when you look at the chemicals that are being used to manufacture everything from food to electronics to the bed you sleep on, it is a dramatically different world than the world that our grandparents grew up in.
Agree.
So, we've got food that we're eating multiple times a day that has toxins in it, water that we're drinking all through the day. If you're drinking tap water, that's got, PCBs, chlorine dioxides. I mean, in Seattle, there are traceable amounts of estrogen in the water because the molecules are so small that they can't filter them out. There's caffeine in the water because everybody drinks coffee here.
Oh my gosh.
And then you compound that with all of the chemicals, whether it's pesticides, herbicides, or just the stuff that we're using every day, from pens to the chairs that we sit on. Yeah. And I think our human physiology is like God made us in his ultimate wisdom, right? Like we are 100%. Able to get rid of toxins and be able to expel things that aren't supposed to be in the body. But the problem is, if we reach a load of environmental toxicity, that our body cannot overcome, then, and you hear me talk about this a lot too, then our spigot ends up getting blocked.
Right.
And if our spigot is blocked and our bucket is continuing to fill up, then eventually the water level is going to spill over onto the floor. And that's when people start to experience symptoms, whether it's a headache or constipation or a rash. That is your bucket too full and your spigot clogged. So you're starting to get symptoms. So, I think those, I would start looking there.
No, that's a great explanation. That makes it really clear. And I always talk about that too with my patients too, and how dis-ease happens, when things start going wonky. If you want to use the word wonky, and like our bucket fills up. You actually taught me that. And I learned that from you, and it makes complete sense. So, all right, let's shift gears. Let's get right into Lyme disease. So you, you didn't diagnose me with Lyme disease, but you have been my Lyme doctor. God, what has it been? 5 years now, 5.5 years, whatnot. But most people can hear my story in episode 1. If you haven't heard my story, go back to episode 1. And I talk about my journey in Lyme and getting diagnosed and how hard that was. I had to went through 10 different doctors, blah, 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 went to Germany. And then I found Dr. Wakely came in my life. And Dr. Wakely, you have been amazing, doctor to me. I just want to say that, that I love you. And I don't know how I would get through this journey without you. And you're the reason why I became a health coach. Little did you know that. Because I wanted to pay it forward. Now I can't do all the things you do. I don't know all the things you know, but that's why I have you. and so the listeners out there, if you need an amazing doctor, of course I'm pointing you his direction, but I am not a doctor. I do not diagnose or treat, but what I do is help guide people and get them tested for Lyme disease. So let's talk about Lyme disease, some stats, things like that, what you're seeing, how prevalent it is and in your patients, and just give me a little background on what you're seeing with Lyme disease right now. Let's start with this. What is Lyme disease? Let's talk about that.
Okay. So Lyme disease is a bacterial infection. And the way you get Lyme disease is, now this is according to the CDC.
Right.
And I'll keep it non-controversial here, at least in the beginning.
Sure.
So you get exposed to a tick. Usually it's the name of the tick is the Ixodes, and there's a couple different kinds. There's an East Coast and a West Coast tick, Ixodes. And the tick in its salivary glands lives a bacteria called Borrelia burgdorferi. And Borrelia is the bacteria that is responsible for Lyme disease. So if somebody gets bit by a tick, then that Borrelia can pass from the salivary gland of the tick into your circulation.
Okay.
So that's what Lyme disease is.
Okay. Got it. So how prevalent is Lyme disease right now?
So, when you look at the statistics, Lyme disease is definitely on the rise throughout the world. Now, whether that's because more people are being exposed or, whether more people are getting tested, we don't know, but it is the most common vector-borne. So, transmitted from a flea, a tick, a mosquito, a fly, something like that. That's a vector-borne illness. It's the most common vector-borne illness in the United States. And it actually, everybody thinks that, Lyme disease is just on the East Coast.
Right.
It's actually been found in all 50 states. And the CDC is saying that there's somewhere between 30 and 50,000 cases diagnosed each year. But I think that is grossly underrepresented.
Right.
And we can talk about why if you want to ask later, but.
Yeah, no, for sure. And, one of the things that I always hear from people is, well, I never got a tick bite. Like, I don't remember getting a tick bite. So, yeah. So, talk about that for a minute. When people say, well, I didn't get a tick bite,
So, well, there's a couple different things, right? Okay. So when people talk about Lyme disease, the first thing that they think about is that bullseye rash.
Yep.
Okay. What we call erythema migrans.
Yep.
And very few people who have been diagnosed with Lyme disease, and I'm talking about conventional diagnosis, only a small percentage of them actually get that rash. So
Interesting.
ticks can bite you. They can fall off. You cannot get a rash. I mean, I've had a lot of patients who, when we go back through their history, they'll say, oh yeah, well, my symptoms all started, at this particular point. And, about a month or two before all of these chronic symptoms started, I had a really bad, quote unquote, summer cold. So I'm like, okay, well,
interesting.
If you don't get a rash and you think you had a summer cold and there's no embedded tick on you, of course you're not going to think that you got bit by a tick. I mean, who would, right? And a lot of people can fight off the acute form of the infection and be totally fine, but a lot of us can't. And that's what leads to those potential chronic symptoms in people who are susceptible.
Right. Yeah. And let me feed into that and lead into that, because a lot of times, like myself, there's other underlying factors, right? And that kind of leads me into like the next question, or not a question, but a statement is, when we have Lyme, sometimes it's not just Lyme that we're dealing with. And you'd mentioned that before, right? There's mycotoxins, there's chemicals, there's viruses, there's underlying things that can go hand in hand with this Lyme. And so I know that testing, we're going to go right into testing right now, is kind of flawed, if you will. I just had a patient come into my office last week. We got her tested through Igenics, and it was like a couple of bands were indeterminate. Band 41 and the other band 80, whatever it was. But she's to a T, like limey. So let's talk about that for a second. So when you have a patient comes to your office like that, which I was going to talk to you about that patient and send her to you, it's not just all based on the testing, right? Because there's other underlying factors too. And so that's where it's so hard to diagnose this Lyme, correct?
Yeah, it's really hard to diagnose it. So the conventional testing is ELISA testing, and that's what a regular doctor would run. But the problem with ELISA is an acronym. It misses about 60 to 80% of the cases.
Really?
And then if you run a Western blot, which is a little bit better, that's going to miss about 20 to 40% of the cases. Now,
goodness,
you take that information right there and you couple it with the fact that most Lyme testing is testing for antibodies.
Right.
And I think everybody in America and probably the world knows what an antibody is now, but an antibody is something that your immune system develops, right?
Yeah.
And if somebody doesn't have a great immune system, if they have a compromised or lower functioning immune system, do you think they're going to have enough oomph in their vitality to develop high enough levels of antibodies so that you can get a positive test?
No.
It's not going to happen. We see it all the time. I mean, we've even seen it with COVID, right? Where we've got immunocompromised patients. They're not going to develop antibodies. And this is a non-controversial statement. It's in the literature. So anyways, you'll get a false negative test. It should be positive, but it's saying it's negative. So that's when, you have to kind of go based on symptoms and signs. And there are other tests, like the DNA connections test the antigen or the actual bacteria directly.
Right.
But it's super expensive. It's like $680. You've got other labs like Vibrant Labs is a little bit more affordable. Armin, Infecto Labs, they're looking at directly at T cell activation. So it's a bit more accurate.
Right. So when you have someone that comes into your office and they're like, look, I've been tested for Lyme, it says negative. And do you just kind of go, okay, hold the phone for a minute. Let's do some further testing. So you have to back it up, because like you said, it's not always going to show up. And I've heard this time and time again. People come to me and they're like, no, my Lyme test is negative. And I'm just like, in the back of my head, I'm like, you have Lyme. And you probably go there too a little bit, like, no, but yeah. So I guess what's the, so to a listener out there that says, no, let's take an example. Someone out there right now tested negative for Lyme, exemplifies all the symptoms that we're talking about.
Mm-hmm.
Where do you go? What do you say to them?
Yeah. Well, the first thing is don't drink the KoolAid, right? So just because somebody has a negative Lyme test doesn't mean it's not Lyme. And I'm also not looking to give someone a Lyme diagnosis, right? What I'm looking for is how do we get symptom reduction and get them so healthy that there's really no room for illness. Now,
there you go. Yeah.
To go back to your question, if I'm suspecting Lyme, I will do, further testing, but I'm also looking at, all the other things, right? Mycotoxins, which are the toxic byproducts from mold, which you can have a lot of overlapping symptoms. Parasites, which are super common. I mean, we think here in America, we don't have parasites. Well, if you eat food or you have a pet or you've traveled outside the country at some point, you could potentially have a parasite. And that doesn't mean that that's necessarily bad. A lot of people do, but, parasites will harbor heavy metals. Parasites can reactivate viruses. Mm-hmm. So essentially what I'm saying is I look at this whole picture and try to figure out, okay, well, if it's not Lyme, then what is it? And is there additional testing that we can do to say, okay, it's either this one thing or more likely it's more than one thing. I always talk about this thing called the pathogenic pie. And it's, me, I always use silly analogies, but
no, I love it.
Most people who come to my door have more than one thing going on. Let's say they walk in with a Lyme diagnosis. Mm-hmm. Okay, great. Lyme disease is not that hard to treat. I could take a person who has chronic Lyme disease, just Borrelia, okay, and who's had it for years, and they can probably be skipping out of my office anywhere between 2 and 9 months, depending on their immune system. Okay. But it's never that simple because usually there's more than one piece in that pie.
Yeah.
Maybe there's some mycotoxins. Maybe there's some chemical sensitivity. Maybe there's some parasites or some heavy metal load or something like that. And it's really about, like you said, not playing whack-a-mole, not just punching down the Lyme bugs.
Yeah.
And then seeing all of these other things shoot up. You've got to treat the whole pie.
Right. Gotcha. Now, Dr. Wakely, what about co-infections?
Yeah.
So that's a whole, we could talk for a whole hour about co-infections too. But, again, going back to my client that came in yesterday and we got the Lyme test and I'm like, Lyme hides, right? It just hides, I guess is a better way of saying it. I tell people Lyme hides. And there can be I've seen people have co-infections that test positive for co-infections like Bartonella. We're talking about people, Babesia, Rickettsia, Ehrlichia. What's the other one I'm missing?
I mean, there's a bunch. Mycoplasma, anaplasma.
Yeah. So anyways, so is that something, back me up on this. Is this a true statement that Lyme kind of hides under these other things?
Yeah. So I would say, Lyme hides in general, right? Lyme disease, Borrelia doesn't like to float around in the blood where it can be found. So the Borrelia bacteria will often hide in places like synovial fluid inside your joints. Okay.
Right.
And then in terms of co-infections, all a co-infection is saying, hey, when that arthropod, when that flea, when that tick, when that fly, whatever it was that bit, when that mosquito, whatever, got on you and bit you, not only did it have Borrelia, the bug that causes Lyme disease, hanging out in its saliva, but it also had some of these other things like Babesia, which is a parasite, or Bartonella, which is a bacteria, or Mycoplasma, which is, also a bacteria.
Yeah.
And so when we talk about the pathogenic pie, then we absolutely need to look at co-infections. And there's been surveys done, and there's research on this where, they've looked at like, I can't remember what the number was. I think it was like 3,500 patients or something, and 30% of them had co-infections.
Yeah. Okay.
So if you're treating Bartonella and Babesia or Ehrlichia or Anaplasma or whatever, it's different than treating Borrelia. You've got to have kind of a different approach.
Right.
And that's where we look to signs and symptoms. Like if somebody has horrible anxiety, fear, night sweats, air hunger, that feels like it kind of came out of nowhere. Yeah, they may have Lyme, but they also may have Babesia.
Right. So when someone comes in, so do we just put the Lyme away for a little bit? And do you just go in and start targeting some of those things first?
Well, in our clinic, we use a variety of different tools to kind of figure out what the biggest fish is to fry.
Right. Makes sense.
So, obviously blood work, certain tests can help. We also use autonomic response testing, which, is a energetic way to try and figure out what the biggest factor is. And then we usually try and treat the thing that we think is the biggest issue while covering them for other subsequent sequela that could pop up during treatment.
Got it. Right. Okay. So patient comes into you, and again, they're like, let's just talk about this patient again that I had coming in, and I'm going to send her over to you. But anyways, you'll get to see more about her. But anyways, so she comes into your office and I show her this it says negative CDC Lyme test. I'm just kind of putting this all together. And how do we test for secondary co-infections? Is there blood work for that?
Yeah, there is. There's PCR testing and FISH testing.
Okay.
IGeneX offers it. DNA Connections offers it, but it's unbelievably expensive.
Right.
So you're usually looking at well over $1,000 in treatment, especially if you do the FISH testing, which stands for fluorescent in situ hybridization. It's an assay that looks for actually the RNA of Babesia in the blood smears because,
interesting.
Babesia likes to live inside the red blood cells.
Right.
So we get into this thing where it's like, okay, well, do we spend $1,500 of your money on on testing, or do we treat presumptively based on your signs and symptoms and, see if we can get some improvement in some of these things?
Right. I'm glad you brought that up, because that was going to be my next feed in was, so here we are, all these testing, right? Testing. And someone comes into you and it's like, I have all this testing, and it says negative here, positive here. And it's just like, it's again, that whack-a-mole game. You're whacking everything and getting all these testing. Like I had bazillion tests done. I had a stack of papers of, testing I'd done. And then I went and it was an environmental doctor that diagnosed me with Lyme. And I went into him and I said, I saw Avril Lavigne on the Today Show and she was talking about Lyme. And I'm like, have we done a Lyme test? And he's like, looking through my stacks of paper, and he's like, we've done everything. He was testing me for cancer, everything. It's like, no, we haven't, and to the listeners out there, I know there's listeners that are in that same boat right now. I really do. And because I see them and people keep reaching out to me, and I know they reach out to you. What would you say to someone that's in that boat right now, that's going through that same thing? What would you say to them?
Well, the first thing I would say is, if you have symptoms that are inhibiting your ability to live your life, if they are keeping you from freedom, and you have sought answers from medical professionals and you haven't gotten any better, then you need to find a different doctor. And it doesn't need to be me, but it needs to be somebody who can look at you and assess your toxin load, look at somebody or find somebody who can look at your immune system and see if it needs to be balanced. You need to find somebody who can work with you on drainage and depuration and detox to get this stuff out. Because if your spigot's clogged and your bucket's overflowing, you are not going to get better until your spigot gets unclogged. That is a big deal. And there's a lot of different ways to do that. You can do it with, lifestyle things from home. And then there's medical treatments that we can do. But I would say you need to seek somebody out who is just looking down different rabbit holes.
Yeah. Yeah, indeed. And then what, and here's the other thing, the hard part that's about Lyme disease is treating it is expensive.
Oh,
it is.
I know.
My husband and I just added up what we paid last year, and I won't tell you, but you can probably guess, and is it worth it because of my health? Absolutely. 100%. Right. No doubt in my mind, it's not worth the money is worth it because it's my life. But there's a lot of people out there right now that are struggling too. And they're like, I have no money. Right. I can't get treated. It breaks my heart, Dr. Weekley. I know you see it too.
I see it all the time and it breaks my heart too.
I mean, we just want to wrap everybody up and, in our arms and just fix them. Right.
So that's where, that's where there's things that you can do at home.
Yes.
And, do you want me to talk a little bit about?
Yes. Yeah. Because that's what yes. That's something I train my clients as well. So let's talk about that. And then we'll kind of conclude here. Yeah.
Okay. Well, the first thing I would say is get the toxins out. So if you're not drinking clean water, if you're not drinking water from a Berkey filter, and I don't have any financial disclosures to make. I don't get any money from Berkey. Okay. But if they're listening and they want to pay me, they can.
Shout out to Berkey.
So I use a Berkey filter in my house. Some people use reverse osmosis, but reverse osmosis is expensive. A Berkey filter is expensive too. It's like $300 or $400, but buy once, try once. And, so make sure you're drinking clean water. That's number one. Make sure you're eating clean food. Don't eat food that is sprayed with chemicals. Right. So if patients are showing up at my door and they're not eating like a 90% organic diet, that's where we start. I'm going to say, okay, you need to start, with your food, because if poison's coming in and you can't get anything out because your spigot's your spigot's blocked and your bucket's overflowing, then you're wasting your money. With me, Right. So clean water, clean food, make sure you're breathing clean air, right? Get outside, go for walks, get in the sun. I mean, we know vitamin D is a big deal. And I have a video on my YouTube channel about the importance of vitamin D. And then there's other things that people can do, like, saunas, saunas are great. And I understand that purchasing all this stuff costs money. But, if you're spending $400 on a Berkey and your grocery bill goes up, I don't know, $75 a week, and then you go spend $1,000 on a sauna, you can spend that 2 days inside a medical clinic.
Yeah.
Right. So if you're doing in terms of sauna, I'll just say the ones that because I always get this question, the ones that I like right now are Clear Light, because they have been third-party EMF tested.
Oh, good. Okay. Good to know.
And then I like the Sunlight ones too.
Oh yeah. The Sunlight. Yeah.
I think those are good. And then you can do stuff with your diet, right? You can do intermittent fasting.
Yep.
As long as you don't have HPA access issues, like problems, with your endocrine system, you can consider a ketogenic diet, which really clears out nasty cellular debris. It decreases inflammatory markers. You're going to turn over fat tissue, which stores toxins in it. I mean, so there's a lot of those things that people can do from home before they seek out, somebody like me or, some of my colleagues, that will, that could completely fix it. Right. Because you're opening up the spigot.
Right. Right. Well, and that's what I do, Dr. Wakely, with my patients is with the health coaching. That's where we start.
Right.
Lifestyle. Yep. So to the listeners out there, that's what essentially the starting point. I'm so glad you brought this up because yes, that's what the starting point is. It's just the simple things. Those don't cost money. Well, some of them do a little bit, but you can still do it within reason,
Right.
So yes, thank you for bringing that up. Thank you. Cause yes. And that is something that's super important is, eating, healthy. It starts with, what is our medicine? It's our food.
Right.
Our food is our medicine. So it starts with that. Absolutely. And if you're drinking Red Bulls every day or Coca-Cola or Diet Coke and drinking those yucky products and eating McDonald's every day, you're going to feel like crap. What you eat is how you feel, just how it is. So, okay, we're going to wrap this up. This has been amazing. This is such great information. I have so many other things we could talk about. Maybe another time I'll bring you back on. We could talk about something else.
Sure.
Because there's a ton of things that you and I could talk about.
I know. Yeah.
There's so many things. And I know there's going to be so many questions. So Dr. Wakely, where can people find you if they want to do a consultation with you? Where can they find you?
Yeah. So they can go to our website. It's holistichealingarts.org.
Okay.
And then I also have a YouTube channel. I only got a couple of videos on there. I haven't done anything recently. I'm updating my website, but my YouTube channel is Top 5 with Dr. Wakely. And it's all spelled out, Top 5 with Dr. Wakely. But I would direct them to HHA, holistichealingarts.org.
Okay, perfect. So you guys heard it there. Holistic Healing Arts. That is where I go as well. Amazing doctors there. And there's 3 practitioners actually and located there. So if Dr. Wakely is unavailable, we will definitely connect you with another fabulous practitioner in that office. I can't say enough about all 3 of them are fabulous. So, but Dr. Wakely, thank you so much for your time. I really appreciate this. I hope some of your listeners out there will get a little bit of a nugget, and I hope this helps you point you in a direction that you need to go. I am here for you always. And if you ever need anything, you guys know how to reach me. The link for Dr. Wakely will be at the bottom in the show notes. So you can contact him if you need an appointment. And by all means, if you need further help or further direction or questions about Dr. Wakely, I'm here for you as well. So with that, thank you again, Dr. Wakely, for your time, and have an amazing rest of your day. And thank you, everybody. I'll see you in the next episode.
Thank you.
You've been listening to the Sweet Life Coaching Podcast. To learn more about the topics mentioned on today's show, please visit sweetcoachtavia.com.